the JAMA Network.
A breast cancer diagnosis in a young woman leaves her with a choice of whether or not to undergo genetic testing.
So what I always say to my patients is, knowledge is power.
Dr. Ann Partridge from the Dana-Farber Cancer Institute says current guidelines recommend every young woman diagnosed with breast cancer should be counseled about and receive testing for BRCA1 and 2.
We're making strides and improving over time how we get the message to young women that they should consider testing.
Since 2006, she and her co-authors began following women 40 and younger diagnosed with breast cancer. For this study, they focused on nearly 900 of these women, looking at genetic testing rates, barriers to testing, and how the test results affected treatment decisions.
In 2006, the rates of testing were in the 70% range, and they went all the way up to about 95% by 2012 and 2013.
The study appears in the journal JAMA Oncology.
While the majority of women are being tested, many are not, and a small minority, but an important minority, report that nobody even talked to them about the possibility of harboring a genetic predisposition for breast cancer or that they should get tested.
Dr. Partridge also says not every woman will choose to be tested. However, it appeared genetic testing or the concern about genetic predisposition did affect treatment decisions.
The majority of these women said that it affected whether or not they underwent a unilateral mastectomy or a lumpectomy followed by radiation or a bilateral mastectomy.
And fewer women reported that concerns about genetic risk affected whether or not they received chemotherapy or hormonal therapy.
It's imperative that we not only help women to get this information, but that we also counsel them, help to support them as they make these treatment decisions, especially in the context of a newly diagnosed patient who's stressed and anxious and needs to have good communication with her providers and good support.
Catherine Dolph, The JAMA Report.